talking about rest is not enough. So quite often when we're injured, or if you think about maybe straining your Achilles tendon or something, you sort of need to rest a little bit for some recovery to happen. But actually, what we find is that's not enough. So what you need to do is then strengthen again, rehabilitate. And I think that's maybe where there's not enough focus in I guess society today. Part of the rehabilitation process. So in terms of rehabilitation, when I see people, I might see that they've strained their Achilles tendon, or they have an Achilles tendon injury, just as an example, or maybe say a patella tendon injury or rotator cuff injury. But for me, it's looking at not only how they got it, but why they got it. And that can be looking at a multitude of factors. That's rehabilitation as far as I'm concerned.
Amazing. So actually, before I scheduled this podcast episode with you, I recorded my own one of my own episodes, and I one of it in it I mentioned something around why we don't move enough to justify rest, because like as from a societal like from a societal point of view, like we're sat all the time, and like why rest. So I don't believe in like rest days when you exercise. Like I think we should be moving every single day of the week. Maybe you have like lower intensity sessions and then higher intensity sessions, but I don't think we should just sit on our bottom and do absolutely nothing for a whole day, and that's classified as our rest day. I mean, when you've got an injury, I think it's a little bit different, but I think it's not long term. It's like very short term. From my understanding of anatomy and physiology, and from what I've seen with my own experience, I would love to know what your opinion is on that.
Okay, I'm going to completely disagree with you.
Okay.
So I think the caveat there is the level of intensity that you're training at. So I see a lot of overuse injuries in my clinic, and I see a lot of burnout. Those are the two things that I see a lot of people do. Now, when I talk to people about recovery, I often talk about active recovery. And active recovery is not just sitting around on your bottom, but actually being very proactive in what you're doing. So making sure you have enough sleep, making sure you have rest periods, making sure you're eating properly, you're getting adequate nutrition, and also managing some of the stresses around that. Now, I'm aware that the podcast is for your mature movers, your older people, but what I'm going to say is one of the things that changed my perception on all of this, because I can be a little bit, on the edge of having slight ADHD, wanting to do more and more and more and more. And I've had two big burnouts, which could have been managed better. So one of my very good friends, she's a physiotherapist and an elite marathon runner, ultra marathon runner. So she does a lot of mountain marathons. She's elite. She wins a lot of them. She schedules in every day in her routine a 2-hour nap for recovery. She literally says she prioritizes recovery over everything. So she's obviously training hard. She's running a lot, but she'll have she doesn't run every day. She has rest days. She'll do strength and conditioning training. She'll have rest days from that. So the other thing that I do here in my clinic, I have a physiotherapy clinic. For those of you who don't know, I'm a physiotherapist. I have a physiotherapy clinic, but I work with a lot of elite athletes. We have the elite sport pathway, and I see a lot of overtraining injuries and a lot of overdoing injuries. And I quite often will prescribe a weekend of Netflix.
Okay, interesting.
So I've gone completely the other way, yeah.
But I know, and I think that's and I actually agree with you in that sense, because I mean, correct me if I'm wrong, you're coming from like an elite sport perspective. Yeah. Whereas for me, I think that kind of advice or opinion is coming from somebody who is doing very little. So like, or somebody who's starting an exercise regime, maybe they've been doing it for a year. Okay. And they're exercising maybe 2 or 3 times a week, and then the rest of the week is rest.
Right. Okay, so if your exercise is going for a 30-minute walk, you do not need a rest day from that.
Perfect.
You need to get moving and do a little bit more.
Yeah. I absolutely agree. You might roll your eyes at me. I train CrossFit, and I mean it's a really good CrossFit gym. It's not like super hard and crazy and nutty and all of that. It's
Yeah.
very like the programming is amazing.
Yeah.
And it's not like a traditional CrossFit box. Um, but like for example, for me going to that, I know that I need rest days from that because it's so
Yeah.
intense, even though I'm not an elite athlete. Whereas if I'm looking at people like somebody who goes to more of a commercial gym, or maybe does a few classes a week, I think that's where that kind of I'm on totally on the same wavelength as you. We need to be moving more because if you've got a full-time job and you're sitting at a desk all day, but you're only
Okay.
going to the gym twice a week,
That's not enough exercise.
no. But I think people
Don't
think it
get
is.
Okay, so one of my big things here, and I come across as very unsympathetic and sometimes as a little bit of a dragon, is that people aren't doing enough exercise, and people partly have been given the message that it's okay just to occasionally use the stairs instead of the lift. Just going for a 10-minute walk at lunchtime is enough, it isn't enough. And one of the things that people will say to me, I talk to people if they have an injury and I look at that, talk about their fitness and their lifestyle and everything. And they say, well, the thing is, Esther, I don't get time to exercise. And I'm like, well, the thing is, your body needs it. So that's like saying I don't get time to sleep and I don't get time to eat or I don't get time to breathe. You make time. I don't, so you
Absolutely.
do need to be, people need to be doing plenty. How much you individually need to do, there's probably a variety or a variation for what different people need and different people can cope with. But certainly for me to be pain free and for me to be a healthy weight, I'm doing a fair amount every day.
I love what you say about being pain free as well, because I think that's when that like not doing enough exercise comes into things. So
Yeah.
from your background, if you please feel free to explain it more in depth because I've obviously seen all of your accolades and I think it's amazing and I think we need more people like you with your background and experience in the world offering your services. But along with that is also explain like how movement impacts a pain free or like a discomfort in your daily life.
Okay, so I can talk about it academically and I can talk about it personally. I'm a chartered physiotherapist. I started working in a hospital in 2003, so I've done nearly 20 years. And I did a PhD looking at using exercise interventions for improving health outcomes and improving walking and balance for people with neurological conditions. So I have a broad background and also quite a specialist background in exercise. So I've worked with a lot of people who have painful conditions. So that can be back pain, hip pain, knee pain, I say ankle pain. And I'd say primarily the main reason that people come through the door of my clinic, so I'm also the director of the physiotherapy clinic here, is because they're in pain. Very few people come to the clinic who aren't in pain. Now, one of the things that I always look at is I'll take a very detailed history of people, of course, and talk around where the pain came from. It might have been from an injury, it might have been from a traumatic experience like car crash or a fall off a ladder or something. But sometimes it is where we're not supposed to say wear and tear, but arthritis, or it could be an underlying condition. So one of the things in my clinical examination that I always do is I test muscle strength. So what happens is when you're in pain, you get into a cycle where you have pain, your muscles switch off and don't want to play the game, so you get weakness or deactivation, which gives you a bit of instability in the joint, which gives you more pain, which gives you more weakness, which gives you less muscle strength. So the first thing I do to people is I work in two ways. One, I sort of look at their overall lifestyle and the bigger picture, but I'll also look at very specific muscle areas. So, for example, if I'll look at someone's glutes or hip range of movement, I'll look at and find which muscle is really weak and we'll do very targeted strengthening for that muscle. Now, overall, I think it's better that you do a global strengthening program because it's going to benefit you in many ways. But if I can identify a weak muscle, we'll definitely do targeted strengthening towards that.
Amazing. So I'm gonna give a bit of a case study now of free advice for me. So I was in a car accident in July, and
Right.
basically the person went into the side of me, And ever since then, so there were like two what are they called? Airbags that went off. So it went into the front of me and yeah, into the side of me. And the first physio that I went to said that I had scapular dyskinesia. And then I've got really fed up with that physio, and I was like, I need a new physio, so I'm going to somebody new next week. Um, and so from my own knowledge and my own experience with the pain and discomfort that I'm feeling, I think I've got some sort of rotator cuff injury. And I can't see my shoulder, no matter how awkward I get with a mirror. It's just not like a straight angle. So I can't really assess the position of my shoulder blade yet. I'd love to know kind of what your opinion is on, well, also if you could explain like what's happened potentially to my shoulder, the damage that could potentially have been caused, and then how that's going to impact me when it comes to movement, but also daily tasks and different things like that.
Okay, so when we have an impact injury or collision injury, again, I don't know quite the mechanics of what happened, but say you have impact at speed, what happens is you get a lot of micro trauma, a lot of micro damage. So if you think about I'm going to do a kind of classic whiplash injury where you're going to like that and back. You get micro tearing in the little ligaments around, micro damage. And then, I see it quite a lot in people who've fallen or in rugby, like that. You get a swelling, of course, for the healing. And then you get a cycle where you get set up, where you have muscle spasm. So your muscles go into spasm to protect the injury. And then you don't move as well. And then you get more pain because you're not moving as well. So you get into a bit of how people kind of become very guarded and braced after injuries like that. So sometimes it's as simple as getting things moving again and getting you out of pain. So I work probably slightly differently to the previous person you've seen. Scapular dyskinesis now is considered to be a bit of an outdated term. We don't talk about that anymore. Sorry if you're listening.
I mean, I agree with you, but so absolutely.
If the physio is listening to this podcast, me and Adam Meekins are on the same page, and I think you probably need to do a little bit of CPD to catch up with that. So we don't talk about scapular dyskinesis anymore. I would want you, like you said, to be assessed to see whether you have injured your rotator cuff, and then or to see whether you've got a whiplash injury. And take it from there. Obviously, I can't give individual advice without having examined you properly, but
No, amazing. And I think that's like really great piece of advice. And I also found it's like super interesting how you talked about like the micro tears that happen, for example, for a whiplash injury, because I guess it's the same for like when you're, as you said, when you're falling. And that's probably a little bit more relatable for the people that are listening. So if you've had a fall or you've tripped over or different things like that, even though it's not as kind of brutal as a car accident, it happens at a different level, but very similarly from a more common accident or injury. Yeah.
Sorry, and then unfortunately, as you get older, if you're not taking really aggressive measures to make sure your bone density and your muscle strength is good, then you're going to be a lot frailer and you're going to be more susceptible to fractures.
Absolutely. And I'd also love to know your opinion on like inflammation recovery and like what you should do when you've had an injury. Let's say you've like tripped over and you've hurt your ankle or
Okay.
something like that, because I think there's lots of misleading information out there. I have my own opinions, and it might be something that I talk about in another episode. But I think that there's a lot of outdated ideas around what we should do when we recover from an injury.
Okay. And sort of what level of injury are we talking about?
Let's talk about like a grade 2 strain or something
Okay.
like that.
So just because of the way that my clinic is set up, I do a lot of first contact work and work for people. So I do have a private clinic, but I also work with a elite sport pathway. So quite often I'll get a phone call from somebody or from one of the coaches will say, Esther, Joe Bloggs has fallen over. Can you look at his ankle? So the first thing that I do when I see somebody, and similarly, I live in quite a rural area, and I'm probably a bit of a first port of contact for quite a lot of the local farmers who would probably don't want to go to hospital. And so the first person they call is me when they've fallen off their quad bike or something. So the first thing I want to do is I want to assess whether you need to be x-rayed, whether you've broken something, whether you need actual intervention. And there are certain criteria that we follow and protocols that we follow for that. So there's guidelines for ankle injury. There's guidelines for different things, and you look at different people's pain levels and range of movement. So once I've assessed whether somebody needs to go to A&E for an X-ray, ideally not in an ambulance. Most of the time, by the time people call me, they're usually mobile and talking. And then, or a concussion, equally, we take that very seriously these days. And then if they don't need to go to A&E and you're pretty sure it's not fractured, I just say, give it 48 hours to settle down. There's not much I can do in terms of physio in that time. So, somebody might need crutches in that time. That's absolutely fine. Or they might need to be really not doing anything. But quite often, 48 hours, I say, is a good barometer or a good guideline as to how bad things are. Okay. So quite often after 48 hours, someone will say, either, yeah, I'm sore and bruised, but I'm okay, or, actually I'm in quite a bad way, I need to come and see you. So I'll get someone into the clinic and then I'll assess and we'll kind of work out what's going on. The bad ones are when they come in and they say, I think I've twisted my ankle, and you look at their Achilles and you think, oh, I think that's a bit more than twisted, but okay. So then assuming that it's an injury that we can manage or treat with physio, what I'm saying to people is you need to rest for long enough that you're getting recovery, but you also need to be making sure that you're, up and moving around so that you're not, just sitting on your bottom for the whole time. When we talk about, again, let's say a tendon injury, the thing that I always say, and I'm sure everyone's fed up with me saying it, but I'm going to use the analogy anyway, is that I have racehorses. That's my passion and my hobby. And if one of my best racehorses was injured, what I'd be doing is I'd be waiting for the inflammation to come down. We wouldn't be letting anyone go crazy while the inflammation's coming down. And then over time, we gradually build up what they're doing. And it's the same with footballers, rugby players, but the same applies to everybody who has an injury. You don't suddenly sit around on your bottom doing nothing for 6 weeks and then go out one day and decide to go and, I don't know, just go up to walk around the full distance of the park. So when my racehorse is injured, what I do is one day we start walking them out for 10 minutes, not allowed to do anything crazy, and then we build it up to 20 minutes, and then over a 3-month period or a 6-month period, depending on how bad the injury is, we're getting them back up to full fitness. It's no different with anyone else. If you fall over, if you have a fall, if you twist your ankle, you wait for the swelling to come down, you make sure you're eating properly, sleeping properly, moving so that your blood flow is going to the area. You might need crutches or support, you might need a supportive bandage or something along that, that's all just sticking plaster. And then you gradually return back to what you were doing.
Amazing. So, two kind of follow-on questions from that. What do you think of the rice kind of practice?
Um,
And
okay, so now that's an outdated practice. We say we don't use that in elite sport anymore. You can use ice if you want because it's going to give you a little bit of pain relief. But when you think about it, looking back, it's quite mad that we ever thought this. Ice isn't going to change what's happening underneath the skin, thank God. Otherwise, every time we went into cold water and put a hand in the freezer, or it was quite hot, we'd be experiencing temperature changes in the cell, and that's that doesn't happen. So you can use ice if you want, and if people are really sore, I have no problem with people sticking ice or frozen peas or put in a bucket of water, but it's not going to change the healing. And then similarly.
do you think it's slow, could potentially slow it down because it's like obviously when the area is inflamed, it's like warming up so that
Yeah.
so that the inflammation process can happen because it's a good thing that it's inflamed because it's healing. However, like, do you think that the ice would stop or not stop necessarily, like slow down that inflammation healing process? And
No, not ice, but ibuprofen.
okay,
Yeah, so we don't use ibuprofen now for
okay,
acute strains. Yeah, so none of my elite sport no one on my elite sport pathway is allowed to use ibuprofen after they've injured themselves, got an
Is
acute
it
injury.
is it just ibuprofen or is it all painkillers?
No, so ibuprofen is an anti-inflammatory. So when we have, just say for example, you imagine that you're, I don't know, walking along and you go over and you twist your ankle and you get that great big puffy ankle. So the inflammatory process is actually the repair process. So what we're wanting in an acute soft tissue injury or a bony injury or fracture, we want inflammation. So we're getting all the blood going down to the area and repairing the tissue, repairing where the injury is. We don't want to be stopping that. So painkillers, I'm actually pretty for using painkillers. If you're in agony, there's nothing worse than not being able to sleep and not being able to do anything. You get awful gnawing pain. But they would be simple painkillers, well, so non-anti-inflammatory painkillers. Now, I'm not against using anti-inflammatories for the right condition. So if you have an inflammatory condition such as rheumatoid arthritis, osteoarthritis, you can use anti-inflammatories and they're very, very helpful, but it's using the right drug for the right condition.
Okay. And for when you get injured, let's say you're kind of not rehabbing or you're not doing anything to look after that injury, what's the long-term effects on your body as we age?
Yeah, that's a really interesting question and a good one that you bring up. Um, so I'm going to go back to the ankle. So the ankle injury that, when you go over or if you hurt your knee, once you start to get into the cycle of having pain, weakness, injury, pain, weakness, injury, it's really difficult to get back out of. So you want to do everything you can to keep your muscle strength. Now, it's at a slightly, on a bigger picture, on a kind of, slightly different area. We're not talking about, say, an individual ankle injury, but um, I'm so, my whole ethos behind everything I do is really promoting people to keep strong and keep mobile. And then I think when we see people lose their mobility and lose their strength, you sort of spiral down. And I've seen it an awful lot. And I'm probably a little aggressive in how I market and say this to people.
I think you have
But
to be though.
you've got to keep moving.
Yeah. And
Unfortunately,
there's so much noise that's like kind of not counteracting what you're saying, but like promoting poor lifestyle choices that you kind of have to shout over that and say like you have to move, you have to like we need to be doing these good things for us so that we can counteract all the bad things that we're doing, but also try and stop doing those bad things by doing those good things.
unfortunately, the effects of a sedentary lifestyle or the effects of not being strong tend to be silent until they become reasonably catastrophic. So osteoporotic fractures, you're not in pain when you develop osteoporosis, until you get that spinal fracture, get the vertebral fracture. And they are awful when they go. And I had a lady the other day who, and I feel terrible about this. She's quite a good family friend actually, and she was a very thin lady. She was sort of a model in the 60s. Had kept that very sleek, very thin. She barely ate anything. I know she won't be watching because she doesn't watch YouTube, but and had been very active until she got arthritis and she'd become less mobile. She was doing less things. She was eating less. She was sort of like the textbook osteoporotic person, and still very beautifully turned out. Very glamorous, very lean, like sort of a supermodel. And then she got in a car and fractured a vertebrae, and that's literally all she did. Was she just literally got in and got back out again, and her vertebrae, yeah, she got an osteoporotic fracture.
Oh.
And I think it was mainly overlooked by it was overlooked by the GP, it was overlooked by the nurses, it was overlooked by the physios. And it was actually her husband really who picked it up and just said, she's not, this is not her, this is not her. And she's actually much better now because they got her onto morphine, and she'd had a bit of surgery to stabilize that fracture. But again, that's those osteoporotic fractures or those osteoporotic lesions, they're silent. You don't feel them until they go. And it's the same with the muscle mass. You know, we start to lose muscle mass as we age, and certainly postmenopausal women are going to be losing a lot of muscle mass just simply by aging. You have to do so much more just to be able to maintain that muscle mass. And then I sort of could talk about this all day rather than specific individual injuries, but as we lose muscle, our survivability of every single injury decreases.
And that's like, I love that, that like, not like that concept. I love the way that you've put that. It's so like shocking, you know, like like that's so that survival element
Mm.
of injuries is something we just don't think about. We overlook it so much.
Hip fracture is a massive thing in people who are older, because you lose bone density, you lose muscle strength, you lose mobility, you lose balance because you've lost muscle strength and because of various things, and then one little trip, hips broken, lose your independence.
Yeah, yeah. And that's something I'm preaching a lot about. It's like all it takes is one fall for your life to completely change, and that's
Yeah,
it. And like bad knock on your shoulder, that's it. And you will really, if you haven't been doing the good things like exercising, strength training, eating well, all of those things that are going to promote a strong body, and your recovery is going to be slow and hard, and that obviously gets much more challenging as we age. So I know that you're very knowledgeable in the Pilates kind of space, and that's something that you're a specialist in. I love Pilates. I find it really hard to find a really good Pilates instructor, somebody who knows what they're talking about and also who can deliver fantastic classes. Um, so what, like one for those for people who have heard of Pilates but don't actually know what it is, what is it, and how can it help us as we age?
my favorite subject. So, I've been teaching Pilates now since about 2007. So it's a few years, and I've managed to really maintain Pilates classes since about then. I love teaching it. Pilates is a form of exercise that's similar to yoga in many ways, but also different. It was invented by a man called Joseph Pilates in the sixties, well, sort of before the 60s, and it gained popularity with dancers. It's a form of exercise that you can do using nothing but a mat. So you don't need lots of equipment. You can use equipment. There is equipment, but you don't have to have it. So it's low load, high repetition, body weight resistance exercises. Now, there's a series of exercises, if you're very classical about it, that you follow, and I do a lot of those, but also for people who maybe have any kind of health condition or injury, there are adaptations that we do. So I am very dedicated to my own Pilates practice. I do every day, 5 days a week. I do a good half an hour, 45-minute Pilates practice. But I also teach a few classes a week. Now, a lovely thing happened to me on Friday. Um, a lovely man who's one of my, well, I didn't realize quite how long I'd been seeing him, but he came to me on Friday and said, Esther, I've been coming to you now to Pilates at 9:15 on a Friday for 10 years. And he'd very, very sad actually. His wife had recently died. He's 82, so he'd been coming from when he was 72. He was a very fit man. He was in the military, and he had gone away for a few weeks after his wife had died. And he said, I really missed it. I've really missed coming. And then I worked out that the whole class actually had been coming to me for 10 years. And when we shut down during the pandemic, we put it on Zoom. And then unfortunately, I lost my teaching studio. So I used to go to their different houses and we do it in kitchens and stuff. So we kept it all going. So the point of this being, I have a group of people who sort of started when they were 60, 70, and now they're going on to being 70 and 80, who've religiously kept up this practice of doing Pilates, very simple yet very effective exercises. Between them, they've got new hips, new knees, heart conditions, got everything going, but they just keep coming back. It keeps everyone moving, keeps the backs moving, keeps them getting on and off the floor, keeps them healthy, and and hopefully also a great support for the various bereavements that we've all been through over the 10 years.
Amazing. Okay, so just to kind of finish off, I mean, I would love you to be able to tell me one tip for injury prevention. So your one top tip for preventing injury, your one top tip for injury recovery, and then any tip that you think would be really beneficial for this discussion around injury and Pilates and movement.
Okay, so injury prevention, get strong. That's like your number one. And I'm going to give you a little example for this. I did loads of Pilates, loads of Pilates, loads of Pilates, always very fit, very fit. And unfortunately, last year my father was very unwell and had cancer, and he passed away. And I stopped doing anything for 3 months. And just because I was probably not mentally in the right space, I was walking my dog, but other than that, I wasn't doing anything apart from going in and out of hospital to see him and sort stuff out. And then I decided, right, I've got to get back on the wagon now. And I decided to get my horse out, and we went for a ride. And I'd lost so much fitness that I just tumbled off the side.
Oh my goodness.
Just out of nowhere. So he didn't really do anything wrong. He just used, and so for me, because I had lost my balance, I'd lost my core strength. I just didn't have the stability and strength to stay on when he was leaping around. And it was a bit of a wake up for me. I was like, oh, that never would have happened in the past. So stay strong.
Get strong, stay strong.
Yeah. On a second note to that, I know we're running out of time. I have to tell you this lovely little story, and that was my mother then was diagnosed with high blood pressure and type 2 diabetes, and it kind of runs genetically in our family. And she got a little bit down about everything too. And she's quite an amazing woman. She's quite a force to be reckoned with, and she had various arguments with the doctors about blood pressure tablets. I wouldn't like to have been on the receiving end. And she said, right, that's it, I'm going to get fit. And she just basically said, right, I'm teaching myself. So she taught herself to salsa dance in the bathroom in the evenings, went for a walk every day. Our dog's quite decrepit. So she said, right, the dog can stay at home. I'm going off out into the, and did the vegetable patch, did a Pilates. And now she is 68 or 69, and she's on no medication whatsoever. Blood pressure is textbook. We've completely reversed the diabetes. Leaping around like a teenager.
Wow, amazing. Good for your mum.
Oh, mum, yes.
That's
Good old mum.
amazing.
Very
Oh,
sensible woman.
very.
What was the third one?
So any top tip that you think would be super beneficial, like something that you maybe take with you every day, or you advise anybody that you work with, if you could give them one piece of advice, what would it be?
Just keep walking. Whatever you do not give up your ability to walk. Fight for it like you're fighting for your life. And so one of the things I do is I have a rule that I don't drive into town. I walk into town always, partly because I can never park anywhere, partly because if I make that a rule in my head that I have to walk into town, rain or shine, no matter what's going on, it just means that I'm getting in that certain number of steps every day around what's happening. So that for me is my rule that I live by. Do everything you can to keep walking.
I think I love that because I work in a private hospital, just like 4 hours a week as a consultant, and there's the offices that we work from are at the top of the hospital, so you have like three flights of stairs, I think, and there's a lift, obviously. And a standard I've set myself is I can never ever use the lift, no matter how tired or like, like if I'm running late, whatever the excuse I could tell myself, I'm never ever going to use that lift. And I mean, I've been there for like 3 or 4 years now, but I've only used it once, and that wasn't because I wanted to, it's because I had to take a patient in it. So I'm really glad that I've stuck to it, and it can be so tempting. But it's something I think you have to set those boundaries, like you've set going to the shops. But like for me, it's like, and it can be so easy. Like my family are not walkers, and like they'll drive 4 minutes down the road to go to the shops, and I'm like, oh, but just walk. And it's just not in their mindset. But hopefully, the more kind of we push this message out, the more people will like just double think and think, no, it's raining, but I'm still going to walk, or like, let's start in the summer and then make it a habit and do that. So I really appreciate everything that you said. And if anybody had any questions or maybe wanted to work with you, where would they find you?
You can Google www.estherfox.co.uk. My clinic is mountkellyphysio.com, and my Instagram is at Dr_Esther_Fox.